The precise edges of the wave tool excel at treating trigger points, adhesions, scar tissue, and myofascial restriction. In this video, I will discuss how to use the wave tool edge release therapy during different stages of tissue injury, recovery, and prevention. The four categories we will cover include acute injuries, subacute injuries, chronic conditions, and maintenance or injury prevention. The term acute injury describes an injury in the very early phases of tissue repair, generally from the first few days through the first 2 weeks of injury. With all new injuries, an inflammatory healing process is occurring, so it's important to be gentle with the wave tool. The pressure should be light, and you should perform treatments every few days for about 5 minutes. The goal is to increase blood flow, decrease inflammation, and stimulate healing. Make sure to avoid causing additional irritation and inflammation. Examples of acute injuries include an acute sprained ankle, a muscle strain, and post-surgery. The term subacute injury describes injuries that are in the secondary phase of tissue healing and repair, generally around 2 to 4 weeks for a typical overuse injury, such as elbow tendonitis, patellar tendonitis, and Achilles tendonitis. Treatments can last about 5 to 15 minutes, 2 to 3 times a week, with moderate pressure. The goal is to cause a mild healing response, increase blood flow, and increase tissue mobility. Do not treat too long or hard, which can cause further tissue damage or excessive inflammation. Chronic conditions are injuries that have gone beyond the inflammatory stages of tissue repair and are stuck in a chronic degenerative process. This includes weak and poorly aligned collagen fibers, adhesions and scar tissue, and poor blood supply. This can arise when the normal process of healing gets interrupted by continued overuse and irritation. Examples include chronic plantar fasciitis, Achilles tendinosis, and elbow tendinosis. With chronic conditions, the wave tool's edges can be used with the firmest pressures. The goal is to break apart the poor quality, misaligned collagen fibers and adhesions while stimulating a mild healing response. There may be some tenderness during treatment, but rarely any residual soreness. Generally, it should feel better to use the affected region after treatment. Treatments can be 5 to 15 minutes, 2 times a week, with rest and healing time between these intensive sessions. The wave tool excels at treating chronic conditions due to the precise IA-stim edges, which can break apart the poor quality tissue while preserving the healthy tissue. The wave tool is also effective at maintenance and injury prevention. This can be done several times a week for 5 to 10 minutes with light to moderate pressures. The goal is to increase blood flow, improve myofascial mobility, and decrease tissue restriction that can make us more prone to injury. With maintenance, as well as with all wave tool treatment, remember to treat local and regional trigger points in myofascial tension. You can do this with the pressure knob, the massage surface, and the levering disc. With the wave tool, remember to always use lotion and to use the edges at a 45-degree angle, pushing through the tissue like you are plowing snow. Keep in mind that the wave tool guidelines are broad and general, but in reality, the treatment of each injury, whether chronic or acute, will vary depending on factors including a person's age, activity level, health, and the degree of tissue damage. Lastly, we will demonstrate a typical 10 to 15 minute session for treating subacute elbow tendonitis. These guidelines may be applied to other overuse injuries. First, begin with broad treatment for 3 to 4 minutes. Do 10 through 20 strokes with the large blade edge both up and down on both sides of the forearm. Next, use the wide arc edge for 10 to 20 strokes for another 3 to 4 minutes in order to hit myofascial restriction with more precision. Finally, you will treat the target tissue for a few minutes using the edge of the levering disc or the tendon release edge for precision work at the tendon attachments along the lateral epicondyle. Lastly, spend a few minutes using the large massage surface and levering disc to treat trigger points and myofascial restrictions. The wave tool is the missing link in your treatment plan and can be used in all phases of tissue healing and repair, as well as for general maintenance and injury prevention. Please see other videos on wavetoolstherapy.com.